Welcome to the Autism Alliance of Michigan Skill Building Series. Autism Alliance of Michigan is guided by the vision that people with autism will lead lives that meet their greatest potential. The mission of Autism Alliance of Michigan is to lead efforts to raise expectations and expand opportunities for people touched by autism across the lifespan. Hi, and my name is Stacy Holland, and I am a physical therapy consultant for Autism Alliance of Michigan, and welcome to our webinar today on stair navigation. Please look for the corresponding handouts and feel free to print them off and use them to follow along with this webinar to take notes if any information stands out as relatable to your child's journey. Today's agenda for our stair navigation webinar will go through the following areas of discussion. These areas consist in the most commonly seen developmental progressions, challenges sometimes faced or seen with stair navigation, as well as suggestions to assist with aiding and challenging a child. Please note that not all children develop through each of these phases equally. They are just suggestions of activities to look at and perform. Please always keep your child's safety in mind, and when challenging a new posture position, please use precautions to keep your child safe and prevent injury or harm. First, we'll look at the developmental progress. So the first stage of stair climbing progression begins with crawling up the stairs. This occurs about 10 months of age, whereas crawling on a flat surface normally can occur as early as 7 months. Around 12 months of age is when we'll typically see one begin to be able to coordinate backward crawling to descend the stairs. Next, by about 18 months to 2 years of age is when a child typically begins stepping up with both feet on each step in what we call a step 2 motion, going up and down the stairs. Now, upward motion utilizes muscles with slightly more force than we do with a flat surface. These muscle contractions are called concentric contractions, and it's where we're shortening the muscle fibers in nature. So when you're stepping up, you think about the muscle contractions as if you're bending your wrist up to your shoulder, thinking of that bicep muscle. That bicep muscle is contracting, it's shortening to bring that wrist up. So that's the same type of movement we're using going upwards. To be able to descend stairs, one uses their muscular control in what we call an eccentric manner. This is the same as when we're slowly trying to squat or control a descent to sit down. We're using our thigh muscles to control that movement against gravity instead of just dropping down to the surface. In addition to using eccentric control to go down the stairs, we also need to use depth perception to be able to determine the distance from one object to the next within our sight. Those with autism commonly have issues with depth perception, which could make descending stairs more difficult. Our last point is considered when one is able to reciprocate or alternate our feet without the need for any type of handhold assistance, both with going up and down the stairs. So some of the issues sometimes seen include, but aren't limited to, the first is poor body awareness, making it difficult to coordinate lower extremities with hand placement. It could be that they have difficulty with weight shifting from their leg that they're standing on to their moving leg. This could also be where depth perception comes into play, and they're not able to lift their leg high enough or feel confident or able to appropriately anticipate the step to lower down to. And then lastly, weakness on one side, which can demonstrate a favored side with ascend. So often the weaker limb would lead going up, and then with the descend, the stronger limb would remain on the step, and the weaker limb would actually lead to the next step. And then, as I said, the opposite is true when going up the stairs, where the stronger leg would often lead. They can also demonstrate poor coordination of velocity production with balance. In other words, have the strength to time weight shift with the production of forward force to kind of push the trailing limb to the next step. With descending stairs, the leg remaining on the step has to control the lowering or eccentrically lower the body down to allow that free leg, the front leg, to reach the next step while remaining balanced. Some compensations seen that would demonstrate weakness with going down the stairs are a quick drop to the next step, knees either bowing outward or inward, as well as stepping down the stairs sideways, to name a few. So some suggestions to aid in the progression of going up and down the stairs. The first suggestion consists of practicing stepping with a shorter step, such as a small step stool or a thick book duct taped so that the child doesn't slide on the pages. Typical stair height is 6 to 7 inches. So starting with a step that may be slightly shorter could help build strength, practice coordination, and muscle memory, as well as confidence. As your child improves the ability to step up and down on the step, you do want to increase the height, as the muscle memory will translate over to the real step. And you may see your child not stepping high enough if exclusively practicing on a shorter step. Next, another way that you can aid in progression is working on controlling sit to stand and stand to sit. This will help strengthen the legs eccentrically with stability and does not involve depth perception. This part practice will train the muscles to control that descent or that lowering, and you may be able to get more reps in if depth perception is something that your child has difficulty with. So just so you know, the taller the chair, the easier the descent, since it'll be a shorter distance until they sit. If the chair makes the child's knee bend more than 90 degrees, this will make standing very difficult. Moving on, single leg balance will allow working on that weight shifting to one side, as well as working on a dynamic motion. So you could be standing on one leg or doing a modified single leg balance while reaching for a toy, ball, bubbles forward to kind of emulate that forward translation onto one foot. If your child doesn't know how to stand on one leg, as I was saying, you can perform in a modified way where they place one foot on the ground and then the free leg onto that book, a step stool, or a pillow. Sensory assistance is often used with stair assist in the clinic by myself. And some of the ways that I use this include the visual input, such as colored bands around the child's ankles to help coordinate the legs with potentially colored dots on the steps, matching the color so they know where their foot needs to go, or just using those colored bands and saying the color of the foot so that way they don't have to think, is this my left leg, is this my right leg? They can just look down and they see the color and they know that's the foot they need to move. Next is we could also use bright colored tape on the edge of the stairs, and this could aid in seeing where the next step ends to help coordinate foot placement. If the area is brightly lit or there's a lot of distractions in the area, you could also place a baseball cap on the child to help decrease the amount of visual stimulus that are pulling the attention of the child away from the stairs and kind of hone their attention to the steps themselves. Next are tactile cues. This could include assisting with moving their hand on the railing or wall in line with the step that they are moving to, assisting in that forward motion with ascending, as well as flexing the trunk slightly forward with descending. Sometimes home steps are carpeted, and if they're carpeted, it may make it difficult for that child to get the right amount of body awareness on the stairs. So wearing shoes or, again, a weighted backpack to increase that body weight awareness could also be beneficial. Some kids that I have worked with enjoy counting the steps. So this is going into that auditory noise. It could help them stay focused on the task at hand. It helps create a good cadence for stepping, and also could potentially create a small reward of saying the next number. With kids that this works with, I make sure they step onto the step before I say the next number. If your child has a favorite subject, you can name the different items with that subject to get the same effect. This includes using shapes, construction, trucks, colors, or various cartoon characters. Now, with stair work, you want to always keep yourself safe as well as your child. A rule of thumb for guarding when working on the stairs is being behind the child, going up, and in front of the child, facing them while going down the stairs. If the child is moving, you should keep your body still to better monitor the child's movement and potentially the need to respond. Again, not everyone is created equal, and these suggestions may not work for all. So that wraps up our webinar on stair climbing. For additional information, questions, and resources, please contact the Autism Alliance of Michigan. AAOM is prepared at no cost to counsel, advocate, and connect families to evidence-based care and support however long it takes. Our navigation program will connect anyone touched by autism to a free lifelong guide with professional help and answers. Thank you for attending our webinar.